Hi, I would like to present to you our research on coverage on lung cancer in Malaysian newspapers. Lung cancer is the third most common cancer in Malaysia, and nearly 90% of the patients are diagnosed late in stages 3 or 4, and this is why the fatality from lung cancer incidence is rather high. What are the risk factors of lung cancer? The top factor is tobacco smoking, accounting for 80 to 90% of lung cancer cases. The second cause is radon gas from the breakdown of radioactive elements in rocks and soil, but very few people know about it. The other factors are family history, poor diet, and exposure to pollutants in the air. In Malaysia, certain groups of people are also predisposed to getting lung cancer, and these include male, Chinese, and older people. Symptoms of lung cancer. Many of the signs of lung cancer in the early stages are very generic, such as cough, headache, and weight loss, and therefore people may not be suspicious. By the time they have shortness of breath, chest pain, or bone pain, they start to get suspicious. People in Malaysia who have better knowledge of lung cancer symptoms are females, younger people, Malay, people with formal education, married people, and people who are not smoking. There are actually websites, lots of them, educating the public about lung cancer, the disease, the prevention, the treatment, and so on. But people may not have that awareness, and newspapers is still an important means to convey the information to the public, according to Zippy et al. 2023. Zippy's analysis is based on the US newspaper from 2010 to 2022, and it shows that there is a lot of focus on lung cancer screening, shown by the blue bars. It's also a highlight on the benefits of the lung cancer screening. But the newspapers, they also highlight two particular barriers that prevent people from taking health preventive measures: the cost and also the distrust of the medical test results. In the case of Malaysia, little is known about how Malaysian newspapers educate the public about lung cancer, which is why we studied coverage of lung cancer in English newspapers published in Malaysia. Number one, focusing on the salience given to the lung cancer, and number two, on the types of information in the articles. The theoretical framework for the study is taken from Hochboom et al. 1952. That is the health belief model with 5 to 6 elements affecting intended action. In our study, we take the cues to action in the newspaper articles as a separate thing from severity, risk, perceived benefits, barriers, and also health protective measures. Method of the study. Our study used the search term lung cancer in order to locate the articles about lung cancer in the portals of the 4 newspapers, and we found 12. Let me share with you the results. Firstly, salience of lung cancer in the 4 English newspapers analyzed. I would say not salient because only 12 articles were found across the 4 newspapers in a 6-month period. But now let's look at the 4 newspapers. Which newspaper give more salience to lung cancer? The surprising answer is it is the Sun, and it is an alternative newspaper. The Borneo Post is a state newspaper in Sarawak, and it is a mainstream newspaper. The other two are actually national level newspapers, mainstream newspapers, New Straits Times and The Star. These are some examples of information highlighted on lung cancer in the newspaper articles. Severity, yes, there is the focus on the symptoms, but it is rather late stage, like chest pain, tightness, or palpitations. Risk factors, most of the time the focus is on tobacco, smoke, Recommended actions. At the time when we collected the data, there was a proposal to introduce a ban on smoking for people born after the year 2005, and therefore the newspapers carried a number of articles about this proposed ban, discussing the pros and the cons. Other than that, recommended action also included generic measures like healthy living. Perceived benefit of health protective measures. The main benefit actually highlighted is reduction of death due to lung cancer, but there are also interesting benefits like having good communication with the doctor so that there is better quality healthcare. Perceived barriers, there again, it is a focus on the proposed ban on smoking for the younger Malaysians. And they say that it's not good because it only drives the whole issue underground, and people continue smoking, but it's difficult for the government to monitor. Right now in Malaysia, this is still being debated. Types of information highlighted on lung cancer. 89 instances of information were found for the 5 types. And you can see that the focus is on severity and risk factors in the newspapers. About 1/4 of the information is on severity, the other quarter is on risk factors, and they appear in almost all the articles, 10 out of the 12 articles. As for the other 3 types, they appeared in less articles, less than 3/4 of them. Recommended actions, benefits, and barriers get less attention. What are the types of information? So let's look into the themes and sub-themes. Severity, a lot of time, the information highlighted are the deaths. Less on the symptoms, the early stage, less. Risk factors, most of the time what is highlighted is tobacco smoking, less on the air pollutants, and the target is on the smokers. Recommended actions, most of the time what is highlighted is generic, like healthy lifestyle. Less suggestion to access website to increase knowledge, a bit of suggestions on the tobacco control and information on immunotherapy, but this is really very minor among all the articles analyzed. I feel that there should be more focus on encouraging the public to go for screening and also providing the public with practical information on how to go about it, because it's good to have the head knowledge, but to get the people to take action, some practical information is needed. Benefits, there is a lot of focus on the benefits of being informed about lung cancer and the importance of avoiding the unnecessary deaths due to lung cancer. Barriers, the newspaper did highlight lack of awareness as a problem, and also addiction to smoking, which means that the smokers may not take the intended action to minimize lung cancer risk. So these are the cues given to the public to take action to reduce the risk of lung cancer. In conclusion, I would say that the newspapers analyzed have a very monochrome approach. That means there is a particular emphasis on certain types of information, such as lung cancer death as a consequence, tobacco smoking as a cause, healthy lifestyle, and regulations on tobacco smoking as recommended actions to minimize lung cancer risk. The situation is different in the US from this Zippy et al. Study, which shows that the focus is on cancer screening and quit smoking programs. In the analysis of the Malaysian newspapers, there's only the Sun which talks about quitting smoking. So there is actually an apparent evasion of the real issues at hand, which is to put responsibility on the individuals to take health protective measures. The lack of salience given to newspaper coverage on lung cancer also means that the public is not getting enough information on lung cancer and not flooded with it often enough. But our study has a very restricted scope, and it is hoped that future studies will go into the uptake of lung cancer risk messages disseminated through the mass media and social media by the government and NGOs. Thank you very much.